So welcome to everyone. I'm Bettina Aprile. I'm going to serve as the kind of unofficial facilitator for tonight's meeting. Just because we do have a number of folks on the call, which we're pretty excited about, we thought we'd go around and do a quick roll call. But things I would like you to say, obviously, who you are, where you're coming from. Tell us how many years you've been reviewing with us, and what do you hope to get out of tonight's meeting. So I'll start. I'm Bettina Aprile. I'm coming from Penn State Hershey, and I serve on the sort of review and planning committee for FMEC. I've been doing this for 3 or 4 years now, and I hope to hear what everyone has to say this evening after we go through kind of our planned agenda. Dennis, do you want to go next?
Sure, yeah, Dennis Gingrich from Penn State, and I'm assisting Bettina and just guiding comments on some of the sample workshops, seminars, lecture discussions, and other options that we have this evening. By the way, those were sent out already. You might want to comment on whether you had a chance to look at it or received them electronically in preparation for this discussion. Thanks.
I can introduce myself. My name is Yvonne McLean. I'm family medicine provider at the Institute for Family Health here in New York, and it's actually my first time reviewing, so I look forward to learning a lot about how the process goes. And I did receive the attachments and have a look through some of them.
Hi, I'm Ellen Tattleman. I'm from Montefiore Medical Center in the Bronx, and this is my first time reviewing. And I want to get a sense for the standards of the review, and I did get a chance to look at all the materials sent.
This is Raj Wolliver. I'm on the FMEC board. I've been reviewing for several years. I have had a chance to look at the materials that were sent out ahead of time, and I'm hopeful that this may give me a new structure to think about using when I do my reviews.
Hi, this is Hillary Malt from the University of Cincinnati. I was on the committee from the host committee last year, but other than that, I'm just a member.
Hi, this is Beth Kariva from Lehigh Valley Health Network. I've been on the planning committee with Bettina for the last 4 years and really appreciate all of her energy behind thinking about how we can change our reviewer process to make it a better experience for everyone.
Hi, I'm Allison Hall, and I'm from Montefiore. This is my second year reviewing submissions for FMEC. I'm just hoping to get some more input as to the standards used for judging the submissions.
Excellent. Well, welcome, everyone. Is there anyone else? I know Larry and Lisa are on here. Is there anyone else on the call?
Hi, yeah, medicine program.
So this is Larry. I could not make out who that was. It seemed to be breaking up pretty badly.
Let me try again. Laura Miller from Mercy Youngstown Hospital in Ohio. This is the first year that I would be reviewing, and excited about learning any pearls for doing it. And I did receive the materials, but I haven't really looked through the submissions. Thank you.
Anyone else? So Bettina and Dennis, if you'd like to take it away.
Okay. So if everyone doesn't mind first, I think to give context, I'll give just a little bit of background about how what we call ourselves the Review and Planning Committee. So we take all of the submissions and all of your wonderful feedback and compile it together to try to build the program with a lot of help, with a lot of work from Lisa and Larry. So I'll give you kind of an overview of what we're looking for when we're taking your comments into consideration as a framework, and then we can practice with Dennis walking through. And before we hit each category, I'll kind of give you an idea of what we're looking for as the Review and Planning Committee from your comments, if that's okay. So first, the overall general framework. We do consider ourselves an entry-level meeting. And what that means is we do accept a large number to nearly all of the submissions. What we do, though, is they're not always accepted in the category that they're submitted, because we do have a lot of first-time submitters. We have a lot of student and resident submitters. So our goal is to get everybody in and help mentor them to their most successful category and their most successful presentation. So some of the ways that we accomplish that are through the host and planning committee and everyone who's been involved with the FMEC for so many years. We usually have connections at most of the medical centers, residency programs, medical schools, that we can identify someone that we know at the site of the person who's submitting that we can direct them to as a mentor if they haven't identified someone already, or we offer someone through the FMEC to serve as a mentor if their submission needs some spoofing up. Another thing that we do is if we feel like the submission is good, but it doesn't fit in the category that they've chosen, we recommend moving it to another category. And that is another place where reviewer comments are critical, because if you make suggestions of where you would move it, if it doesn't fit in this category submitted, we can use that to move it. And finally, if a submission looks great as it is, we would just accept it in the category that it's in and provide some general feedback. Over the years, the only things that we've outright rejected were when someone were to submit just plain PowerPoint slides without any other contextual timeline or information or background or anything like that. Otherwise, we're willing to do feedback, offer consults, offer mentorship, and so forth. So that's the general overview. Are there any questions about that or comments from folks who've reviewed for us before?
I have a question. I was going through my submissions before, and I have one that was, I thought it was a resident who just hadn't read a lot of the background data, and I was actually going to submit my own name to him in the comments because I know it's printed in the comments, that he could, like, if he wanted to, I would help him revise it or, like, refine his topic. Like, is that, it sounds like there's a system in place for people who need a little bit more refinement. Is that, how would I go about recommending that?
So that's absolutely wonderful. That's the spirit of what we do. And what I would say is you could do it any number of ways. If you felt comfortable putting it in the comments, that would be fine. If you weren't sure about that, you could contact Larry or one of us on the planning committee and let us know if you were comfortable connecting you with that person or something like that. Often we'll get submissions that are very similar from different institutions or different states, and we'll actually proactively ask the two separate submitters to work together and combine, and there have been some great networking and collaboration opportunities who have come out of that. So I would say any or all of those things that you're comfortable with, we welcome, and that's the whole spirit of FMEC. Does that answer the question?
Yeah, I was just, thank you. Sorry, I was just wondering what kind of mechanism or what I should really, because I don't want to be discouraging. I would like to be encouraging, so.
Oh, absolutely. Yeah, so if you're willing to be connected, we can either facilitate the connection. If you want to just provide your information, that would be fine. Any or all of those ways, we just welcome the collaboration for sure.
Okay, thank you.
Larry, I don't know if you have anything to add to that. I'm sure there have been other ways of collaboration over the years.
You know, what you described, Bettina, is the primary way. We're always looking to get people with common interests working together and bringing them together like this so that they can have a planning call and figure out how their expertise can be shared during a presentation. That's our kind of a prime vehicle for us. So that's a good explanation.
Other overarching questions, concerns, or anything before we kind of look at some specific missions just for some practice and tips? Okay. So typically when we sit as a planning and review committee, we start with the workshop submissions because given that those are the biggest chunk of time per session, we kind of spend a little bit more time starting with those. So I thought we'd look at those first. And before Dennis jumps into just some practical looks at how we might walk through scoring some of these things, I just wanted to just highlight some things that we're looking for as, again, the review and planning committee. First is when we're looking at the category, sorry. Oh, sorry about that. I thought I heard some noise. So when we're looking at the category, we start with the type, obviously being workshop, and we're looking at the time. So a workshop is 2 hours in length, and it's meant to be highly, highly interactive. So probably one of the most important things when you're looking at the workshops would be make sure there's enough content to fill the time and that they've spelled that out explicitly and that you feel as though there is an explicit amount of interactiveness that is some sort of skill set being taught or practiced. And so then when you're looking at scoring it, this one's out of a total of 25 because there are 5 questions which we will walk through. And then finally, I know I said this already, but when you're walking through the submission, if you feel like it shouldn't fit as a workshop, but that it is a good content or a good idea, please do make a recommendation if you feel so inclined as to where you might move it to. Because most often these things can be moved to other categories, seminars, breakfast discussions, posters, kind of wherever you see fit. And so it is helpful to keep on hand the descriptions of each of those as you're going through whichever category you're reviewing. So I will stop talking and we can move on to doing some practice and we can start with the workshop.
Why don't I pick it up from here, Bettina, and we'll just look at the workshop submissions. We have 2 workshop submissions, and if you had a chance to look over this material already, that's great. If you can pull it up right now, that's fine. It did come through electronically. If you can't access it and didn't look at it, perhaps you can listen to the discussion and look at it later. But I think this is probably, looking at examples is, I think, probably the easiest way to do it. I might also, before we start this, just echo something that Bettina had said and Larry had reinforced, which is FMEC offers a unique opportunity for interaction that most conferences do not. And I've done submission review for other organizations and meetings, and it's not the same as FMEC. And I was sharing with Bettina when we were discussing this, for most other organizations, you give red lights and green lights, you accept or reject. But FMEC reviewers are not traffic cops that give red and green lights out. What we're doing is almost consulting. We're almost giving free mini consults to say, okay, these are things that you could think about when you present, and by the way, this would probably work in this category, or it might be better in another category. So we're actually doing sort of consultative processing. That makes it different. I think that's more important for us to think about as we review the submissions. It's not the same as most organizations do. The other comment that I wanted to offer was that we have review forms, which those of you who have reviewed previously are aware of. And by the way, there probably will be a process coming in which we review the review forms as well to see if we like the way it's set out, or if we have any ideas for improvement. The review form for workshops, for those of you who may not be so familiar with it or didn't have a chance to look over it, includes a couple of items. The specific areas that we're reviewing are: this submission is well written and clear to the reviewer. The topic is relevant to the field of family medicine. The topic is likely to appeal to a reasonable number of faculty, fellows, and residents. The author has a reasonable command of the material he or she intends to present, and the presenter's plan to involve the participants seems adequate. And there are 5-point scales with each of those. And then there are other comments that are included later in the form that say there is sufficient material to justify a 2-hour block of time for this workshop presentation. And then, of course, space to indicate whether it would be accepted as a workshop or perhaps moved to another category, and if it's one of the 6 best workshops you've reviewed. This format is used in most of the other types of presentations as well, with occasionally some modifications. So that's what we use, and that's what we'll be going through. So having said all this, let's look at the 2 workshops that were submitted as samples. These are not designed to be terrible or perfect. They're designed to have elements that are good and bad that we can weigh one way or the other. So I'm also going to rely on some comments from the group to roll this along. So if you wouldn't mind volunteering answers to some of the questions I'll throw out, I would appreciate that. Let's start with the workshop, the osteopathic workshop. It's labeled Workshop Osteo. And the title is First Rib Problems, an Osteopathic Approach to the Diagnosis and Treatment of the First Rib. And then the submission follows. Are there any general comments for those of you who had a chance to look at previously or now the workshop Osteo on the submission? What sort of things stand out as good or bad to you? Feel free to say anything. There are no wrong answers.
They did a good job of outlining how they intended to use the time.
For someone who doesn't know anything really about osteopathic medicine, the abstract is a little short and has these abbreviations that I don't understand, HVLA and LAR. So that was difficult for me.
I like that it's kind of a catchy title. I think that's something that also kind of speaks to the, I don't want to say laid back nature, but just the kind of friendly atmosphere and positive atmosphere of FMEC.
These are all great comments. Any other general comments? I think you can see, especially for those who haven't done a lot of reviews before, I think you can see that there are positives and negatives that we're weighing in terms of our interpretation and assessment of the workshop. So let's just look at the scoring sheet, the review sheet. So the submission is well written and clear to the reviewer. What do you think on that? Would that be generally good, generally not so good, areas of improvement, clarity for the reviewer? So because you've contributed some general comments, I'm going to contribute some specific comments, and feel free to agree or disagree with me as you look at it. So I thought the title was catchy also. I thought it was clear in terms of what it was. I think the abbreviations do reduce the clarity for someone who's not familiar with the meaning or words that the abbreviations stand for. There is, I think the write-up itself is clear. So overall, I think the clarity would fall in the middle. Probably, I would rank it probably a 3 or a 4. Other comments?
It sort of strikes me that the piece identified as the abstract is not sufficient. But when you actually go and read the full submission at the bottom, then there's additional information that helps to round out what they're trying to accomplish.
Right. That's a very good point. I try not to be too influenced by where the information is in the submission. Sometimes you can glean information about what's going to happen in the workshop and where it's coming from and how it's integrated together in sections that wouldn't ordinarily tell that information. And so I give credit for that personally. What about the topic being relevant to the field of family medicine?
Well, especially given that FMEC has a long history of having an osteopathic track, it's very applicable for our particular conference, and I would say in general to the field of family medicine, increasingly so, especially with combined accreditation.
Yeah, even as a non-osteopath, I went to some of the osteopathic sessions at the last conference and thought they were useful and interesting.
So the fact that it's osteopathic material probably automatically makes it more relevant to many of the attendees, whether they're residents, fellows, or attending physicians or students. And so the first rib problem probably falls about in the middle of musculoskeletal issues, but I think osteopathic background ramps it up a bit. So that would probably end up about a 4 for me when you averaged it together. How about the topic's likely to appeal to a reasonable number of faculty, fellows, and residents? What do you think about that one?
Well, I do think as an allopath, first rib problems are not part of my normal vocabulary, so they could do something to help me better appreciate the significance of the first rib.
And this is Larry. So just a comment
ahead,
picking up on Raj's point of view. So as a reviewer, even though you may be an allopath and not an osteopath, I think that kind of feedback that Raj just gave would be very appropriate to put in the review comments so that the presenter hears that not just from us as the planning committee, but from the reviewer. So they have to understand their audience. So I think that's very helpful to do.
Yes, understanding the audience is important. So, well spoken. What about a reasonable command of the material he or she intends to present? So that would be a matter of looking at the descriptors. And so we need some level of detail for that. Did they provide that for us?
I think in their description of how they plan to cover the material in the workshop, there's a sufficient amount of detail of exactly what it is they want to do and how they plan to accomplish it, and demonstration of some expertise in that area.
Actually, quick question here. So when you say, do they have command? So if it seems like if it's a submission that perhaps doesn't have sufficient references or that sort of thing, does that weigh in to whether they have command of the content, or is that we shouldn't add that as a criteria? Is there sort of just like a minimum or of references? Are we saying like you can submit no references at all? Like how do things like evidence-based fall into the criteria?
That's a really good question, especially since evidence-based medicine is becoming more and more important at all levels of education. Many of the submissions are coming in with references, but many are coming in without references as well. So I haven't applied the references as a requirement for demonstrating reasonable command, although references enhance my confidence that there would be reasonable command and would affect my grading of the submission. So with this particular one, I think it would fall again within probably a 3 to 4 number for me in terms of reasonable command. Moving on to the next section, the presenter's plan to involve the participants seems adequate. This is a good one. This is one of the harder ones to figure out. Does the plan involve the participants, and is it clear how the participants are involved, and does it seem adequate? This is, for me, probably the hardest one that subset to adequately evaluate. What do people think?
So I know when we send in these submissions, there is a kind of like almost like a timeline, what you're going to do in each part. And I feel like maybe in that section because I can't tell from this whether he's going to be or she is going to be demonstrating this, or is everyone going to be trying it? I can't tell, but maybe in the next part of the application it might have been there.
I would sort of agree. They don't give us a nice timeline, but if going through the material they submitted at the end here, they do sort of do a step-by-step of what they plan to do. And they give some specifics as to how they hope to accomplish that with sort of demonstrating various palpatory diagnostic approaches to the first rib.
So I'm probably a harder grader on this section than the average reviewer, I'm thinking. I think it's clear where they're going through the time, but I would probably lower my score on this one a bit because the specific time allocations are not present, and some of the process elements aren't present, like are they going to be specifically having conversations? Are they going to be doing demonstrations? Are there going to be multiple demonstrations simultaneously, or how is the process going to be working? So because of those, I would probably grade it about a 3. But I think some reviewers would grade it higher than that because the basic content of each element is there. I'm grading a little lower because I worry when I don't see time attachments that it could run too long and the presenters might possibly not be able to get everything into the workshop format even with 2 hours. Any other comments on that?
I'm just going to echo you, Dennis. This is Bettina again. I'm going to echo, when we're looking at these, particularly for the workshops, we do hone in on if there's a timeline and a clear and explicit explanation of how it will be interactive. So will the participants be observing or will they be practicing? So we do really put a lot of emphasis on what you've talked about. So I just wanted to echo that.
Hi, this is Lisa. Can I make one quick comment?
Please.
The examples that you all have are from last year, 2017, and this year we tried to tighten up all of the proposal requirements so that you could get a better idea exactly of how they're going to use the time. We reformatted the online form and made those required fields so they had to be more specific about how they're going to spend their time, what their goals and objectives are going to be. So hopefully when you get your submissions this year, if you haven't already reviewed them, hopefully you will see a more filled out and fuller proposal, and hopefully you'll get a better timeline this year so that you won't be so ambiguous about what they want to do. Hopefully you will have more information this year to fill out and know exactly what they're going to do with that 2-hour time slot or the 60-minute time slot for the seminar, because we did realize that the form we had previously was letting them kind of skate through and not really fulfill and give us enough information to adequately put them in the right category. So we've tried this year to tighten that process up. So as you go through your reviews, let us know how that works. Give us some feedback on whether you got more information, if it was adequately filled out for you, and give us some feedback on what further improvements we need to do so that you have better information going forward to score it adequately. So that's only fair to you and to the presenter to give them better feedback, and they need to know what we expect so that we can adequately grade them. So just wanted you to know we are working on tightening up the proposal part of each submission. So give us some feedback this year on what you think, if we're in the right direction or whatever, what further corrections we need to make. So thanks for letting me add that.
Thank you, Lisa.
Thank you, Lisa.
So do you think, just looking at some of the rest of the evaluation, do you think this works as a workshop, or would it be better in another category, such as seminar, lecture, discussion, or even perhaps a poster or breakfast discussion? What do you think?
I actually think it works really well as a workshop because of the 2-hour timing. I'm reviewing some of the seminars, and I feel like at least with osteopathic seminars, time can be a big challenge for people because in the time it takes to diagnose and create a differential and then teach the modality of therapy and then have people practice, oftentimes you are very limited with time. So I think this actually works pretty well for at least a workshop.
Well, and I also think that part of osteopathic medicine is being able to demonstrate a lot of these aspects, and so it's harder if you just talk about them versus having, in real life, in the moment kind of demonstration. So I don't know how well it would work as just a discussion or one of the other sessions.
So I think I would join the consensus for keeping this as a workshop. The workshop is the most hands-on type of format that we offer. And in fact, what could be more hands-on than osteopathic manipulation? Truly, that's a sort of a tongue-in-cheek joke. Feel free to laugh. Or not. but truly, it would be hard to put in another modality because of the highly interactive nature of the manner of teaching. So I think it would probably stay a workshop in my assessment as well. That concludes my quick summary of the first workshop presentation. It's clear that we're not going to get through every possible type of modality of submission, but let me ask you, Bettina, if we could go through another one, would it be best to look at the other workshop or perhaps move to the seminar presentation?
I think moving on, I'll make one quick comment to kind of close the loop, and then I think we can move to seminar because I think this was a really good exercise. So from the Planning and Review Committee standpoint, so now we've received Dr. G's feedback back from him about this. He thinks it should remain a workshop. he has commented that maybe a clear elaboration on time and how that time will be utilized would be helpful. So just to give you context, you all received de-identified information. So this was submitted, let's say, by a student from a medical school and no faculty was attached. What we might do from there as the committee is identify a faculty at their home institution and connect them for mentorship, or identify one of our fabulous osteopathic folks who coordinate our osteopathic track to serve as a mentor to the students to further elaborate on their submission and tidy it up in time for the presentation. So just to give you an idea of how we might close the loop, use collaboration, make connections, mentorship. So we've been able to really capitalize on your feedback and bring it all together so everybody learns, grows, and wins from this, just to close the loop there.
Thank you, Bettina. Are there any questions about workshop evaluation before we move on to seminar?
Would there ever be a time that you really, I mean, of course we want to approve it and mentor it along, but would there be something in a presentation, like if there was no delineation of, or not enough, would they approve pending that, or is it just assumed that any comments you make will have some sort of closed loop on them?
We often will approve pending updates with mentorship and a brief resubmission. So we would ask for the timeline and interactive portion of this one to please be reevaluated with the help of a mentor and get that back to us by a certain date. Almost all the time it is fixed appropriately and we feel confident that then we're putting something nice in the program. So there is we do each take and do the feedback and bring it back full circle. So yes, that's a great question. And we do ask for a partial resubmission if there's a lot of updating that needs to be done.
I don't have the form right in front of me. Is there a place for that? So like on the form, like whether or not you would really need a resubmission before you could fully approve it versus just approve and then write that in the comments and hope it gets followed up on?
So there's an open comment section. So I would say the more that you could make suggestions such as that, the more helpful it is to us on the committee. So if you feel strongly that if some portion were resubmitted, please let us know that, because that is exceptionally helpful to us. But there's no official place. I would say just put that in your general comments.
Okay.
Any other workshop comments? Okay, then why don't we move on to the seminar? And this looks like it's turning into an osteopathic evening here, because the seminar is also osteopathic. It's osteopathic manipulative medicine in post-concussive syndrome. So just taking a look at the submission, and I'm going to ask for general comments based on the fact that we had just gone through the various categories. And the seminar categories are the same as the workshop categories of the evaluation forms. And just as a reminder, is it well written and clear? Is it relevant to the field of family medicine? Is it likely to appeal to faculty, fellows, and residents? Does the author have a reasonable command of the material? And does the presenter's plan involve the participants? So take a look at this seminar, and what do you think?
And the time frame on a seminar is 1 hour.
So what about clarity? Let's look at clarity. Is it well written? How clear is it? So as I look at it, it's pretty clear where the authors want to take it. But I think I would downgrade it a little bit because I normally like a little more detail than was submitted in the submission for understanding some of the finer points of what would happen within the seminar itself and the content and direction. So I would probably give that about a 3 in this case. What about relevance? Relevance to the field of family medicine, osteopathic manipulative medicine, and post-concussive syndrome. So I'm just going to, when there's a vacuum of discussion, I'm just going to jump in. Concussion has been pretty much in the forefront of a lot of sports medicine discussions and is seen frequently enough with enough decision-making points within its management that I think it would be pretty relevant. And some of the CME and educational materials that are coming through from AAFP also have concussion material on. So I would say that this is pretty relevant, especially since it offers manipulative techniques that would not typically be used in my practice. So I would probably give that at least a 4, maybe a 5. Does it appeal to a reasonable number of faculty, fellows, and residents? Any comments on that? I think given the interest in sports medicine and how common concussions are and the need to deal with it on a primary care basis, I think it would probably likely appeal to a reasonable number. I'd probably give that about a 4. In terms of the author having command of the material, any thoughts on that? That's one of the harder ones to assess. Does the author have command of the material? Any comments on that? I think I would be influenced by the fact that there are no references. We had talked about that before. I would like to see more depth in the submission itself to demonstrate that one way or the other. So because of that, I'd probably give it a 3. And then the last one, I'll just keep rolling. The last one, the plan to involve participants seems adequate. Again, I would be influenced by the lack of a clear timeline in terms of involvement. I get a sense of where it's going, and I could probably construct a timeline more or less based on what was submitted. But again, as I mentioned before, I rather hate to do that because if I'm wrong, then it might be that some areas are emphasized a lot, others are emphasized less, and the presenters may run out of time in an hour format. So I would probably rank that about a 3 also. In terms of should it be accepted as a seminar or should it be presented as something else? If anyone could offer comments on that, I really would like a comment or two on that because that's kind of the bottom line question. Should this be accepted as a seminar or should it be recommended as something else, a lecture discussion perhaps, or a poster? Any comments on that?
So I think based on our conversation before, if we could see, because the osteopathic techniques do take some time, it probably warrants the time of an hour, but I would give this one of those like qualified acceptances saying we would need a little bit more depth resubmitted and a more elaborated timeline with specifics about how interactive it would be. And if we could get that back, we would consider accepting it as a seminar. So we would do like a modified acceptance.
Any questions on the seminar evaluation? Bettina, shall we assume silence means consent, that it was perfectly clear? I think that's the way we'll interpret it.
Sure.
I guess one question would be, it is really helpful to be going through some of these examples. Who would we reach out to if we were reviewing something and did have a specific question down the road?
So I would be happy to volunteer the four of us on the review and planning committee. And so what I can do is have Lisa share our information, and specifically I could take any email questions, and if I couldn't answer them myself, I could give them to the other members of the committee. So I'll have Lisa share my email with everyone on the call tonight and all the reviewers, so that if there are specific questions, please don't hesitate, because we can get the answer for you, or some semblance of an answer.
Very good. Bettina, do you want to offer any final comments on seminar submissions?
No, I don't think so. The same thing, the circle back is that we would take everything that we discussed and give that back to the presenter and ask them to, in this case, to resubmit with the modifications requested by the reviewer.
Okay. Do you think we have time to look at one of the lecture discussions?
Yeah, I think that would be a great idea. Just one.
Do you have a preference? Which one?
Let me see here.
Dennis and Bettina, how about one that's not osteopathic?
Right, that's what I'm looking for. I'm finding that I know one of them was not actually. So, how about strategies that address the primary care workforce challenge?
Hey, folks, this is Martha. I've actually been on in the background because I was driving for a while, and I don't have access to the documents. I went into the Google thing, and I can't get there. It's been fine. It's been really great to be listening in on all this, but I'm just wondering if is there a quick way to look at it at this point or not? I clicked on the Google Doc thing, and it's an empty folder for me.
Hi, Martha. It's Lisa. I can try and email that to you real quick. Hang on.
Okay, great. In other words, just keep going. I don't want to disrupt things. I just was one of them. I'd love to see the thing.
No problem.
Thank you.
Lisa, this is lecture discussion, strategies that address the primary care workforce challenge.
Got it. Okay.
I don't see the number here, but.
Gotcha.
So thank
Martha.
You. It's good to have you on board.
Well, it's been really great to be hearing everything, so I appreciate it.
Great, thanks. So Bettina, the two lecture discussions that I have here are the integrated care continuum, lessons learned in a primary care clinic and a community mental health center, and clinical and educational use of point-of-care ultrasound.
Oh, I'm sorry. You're right. I read the wrong line. You're right. It's the integrated care continuum one. I read the wrong line. I apologize.
Okay, so let's do that one. So
yeah.
let's look at lecture discussion number 1. The integrated care continuum, lessons learned in a primary care clinic and community mental health center. So any general comments for those of you who have access to the electronic folder? What do you think about this one? Lecture discussion criteria are similar to those that we've already been using for workshops and seminars.
And I'm sorry, could you remind me what the time is like for the lecture discussion?
So they are 20 minutes, although one year I think we by mistake made them 30 minutes. Larry, can you confirm that they are meant to be 20 minutes?
They are meant to be 20 minutes, yes.
Yes.
Because they're only 20 minutes, the one difference in the form for evaluation is that it does not include a section for participation of the audience.
Correct.
Because it's only 20 minutes.
Hi, this is Cynthia Kim. I have a comment about the abstract. From the outset, just kind of reading the abstract, it doesn't really sound as if they're actually talking about integrated behavioral health. It actually sounds like they're talking about more of a psychiatric liaison type of clinic. So I would wanted them to flesh out a little bit more their rationale for calling it an integrated behavioral health and primary care clinic, because it doesn't really seem to fit most of the models that I've seen in practice or in the literature.
Mm-hmm. Mm-hmm. Good point. Thank you. Other comments? So again, let's look at the categories. Did it seem clear and well written overall? There's certainly a lot of detail. Yes.
Yeah, I was actually just gonna say it, to sort of piggyback on the first comment, that in order to do that and in order to flesh out a few more aspects of this, I actually don't know if 20 minutes would be sufficient for them to, if they really are going to get into the meat of it, because it seems like they do put a lot of detail, and they spend a lot of time sort of explaining the different components and who's going to be involved, et cetera, but then to get to the how is this integrative and how is this helpful and how did it work, I don't know if the 20 minutes would work. Is that a possible comment? Would we actually change something to something that would be longer versus shorter?
Well,
yes,
we can certainly
made changes like that before. Mm-hmm. Oh, sorry.
Certainly choose to do whatever we wish, whatever we think is most appropriate, because it's our job to, as reviewers, to make recommendations that we think fit and will help the author and will strengthen the conference. It is much more common, as you know, for those who've been evaluating to recommend switching to a lower level of time commitment than a higher one. But a higher level is not precluded.
And don't forget, if you thought this needed more time but couldn't be, quote, interactive enough to be a seminar, we have formats such as the posters, breakfast discussions that are lengthier but don't require the set amount of interactiveness on the timeline.
So, in terms of written and clear, I would probably give it about a 4 for clarity. I think that fleshing out the definition of integrative behavioral health is a limiting factor, but there's also a lot of depth in what they're thinking, how the ideas relate together, and how it's going to proceed. Relevance to the field of family medicine.
I think very.
I think very also. So that would probably be a 4 or a 5. In terms of appealing to a reasonable number of faculty, fellows, and residents.
This is one that I always have a question on, because if it appeals to one part of the audience, so for instance, if it really appeals, if it feels like it would be something that would be particularly appealing to faculty, but I'm not sure that it would, and not looking at this, but this particular one, but talking more in general, but it doesn't, we don't think it would appeal as much to students or something. Do we put the score down if we think that it would be really vitally, so I get confused on that one, because sometimes I think, wow, this would be fabulous for this one group, but it would leave the others in the cold.
I think there are different ways of handling that. My personal answer would be, if I thought it was terrific for a particular group. I mean, all the conference is well attended, as you know, so that even subgroups have a lot of people that are coming. So I would probably upgrade it for that reason, and then add in my comments the group that I thought would most benefit from it or be most interested in it.
Okay, good.
And to echo that is particularly important for the committee, for the Planning and Review Committee, because we do then allocate those to track either faculty, residents, students, and so forth. So I would say, regardless of what score you ultimately decide on, please feel free to, again, put that in the comments, because that helps us to build the program much more strongly.
Okay, that's great, because that's how I think I've been doing it, but I was wondering if that worked. Okay, good. Thank you.
Great question.
Definitely. What about reasonable command of the materials? Any thoughts?
This one has references, so I mean there are some detailed descriptions in the actual submission itself. So it seems like they do have a better grasp on what they're talking about.
I think the references definitely help. The level of detail, the commentary itself would probably put this in a 4 or 5 for me. What about accepting it as a lecture discussion? Is it about the right depth? Is it about the right time? Or not? We've already heard some reservations. Maybe it's going to take longer, and maybe it should be in something that would be closer to an hour rather than 20 minutes, which could go either to seminar or to breakfast discussion or poster. Any thoughts?
Yeah, I thought the timeline here is not what I usually see in a lecture discussion. I mean, usually there's a presentation and then there's some time for discussion, with the group is there. And you might be able to do this in 20 minutes if it were set up that way, but the way this is set up is that there's an introduction of speeches and obtain audience goals. I don't think it's going to work in 20 minutes.
So the timeline actually marches out to 30 minutes, I think, that they themselves have placed here.
So
well.
So that's a that's a warning sign.
Right.
If the author thinks it's going to take more than 20 minutes in the submission. So again, what you can do, the comments are just so important. What you can do is just indicate concerns that it would fit in a lecture discussion format. You don't necessarily need to decide where it goes. You can just say it probably will take 30 minutes or longer to present, and that it may be better going into one of those options. If you have a strong preference, you can put that in, but you don't necessarily need to specify the destination. At least my understanding is if you put comments in, that would still help. Bettina, would you like to maybe weigh in on that as well?
Yes, absolutely. Don't feel pressured that what you say is what has to happen. We welcome all the comments because it helps for a more fruitful discussion at the planning committee meeting, but ultimately we're able to kind of decide based on numbers and everything else where things go. We just really welcome the reviewer comments because they are so helpful and insightful and useful, but don't feel pressure and don't feel afraid to write down just what you think, because we can decide from your comments how we utilize that information.
So this is Larry. I'd like to offer a kind of a perspective comment. So, all of these submissions come in, and we really rely on the reviewers' careful thinking about you. You've all presented at meetings. You've certainly been participants at meetings. You've probably seen good, bad, and ugly, and you probably have opinions that have been influenced by your experience, and you've probably also been presenters yourselves, and you've got ideas. And we really want you to use your, call it your practice wisdom about presentations. The goal is a high-quality, energetic, interesting meeting that builds community. And if you, in your experience, I guess what I'm trying to say is you have the power of one here to say, here's what my thought is about that. You can obviously use your scoring to send a message, but your comments also, we really do rely on those. We have very rich discussions at the planning committee level. So please, I want everybody to feel, what would you call it, empowered to use your best judgment. And actually, the more times you participate in the review process, the more years the finer your skills will get. But please don't hesitate because you're new to it, or you have some kind of hesitation.
Thanks, Larry. Bettina, I might punt back to you and say it looks like we might be approaching the witching hour.
Yes, I think we should close up. I just had 3 final closing comments, which will sound redundant, but I just want to emphasize. If there are any questions throughout the process, please, I'll give my email to Lisa, who can send it to everyone. Please email me, and I'll send your question to the appropriate planning committee member, and we'll get an answer for you. 2, if you have specific feedback about how the review process felt for you, i.e. the forms, the scoring sheets, if something felt super helpful or not helpful, please let us know, because as Lisa had alluded to and as Dennis had alluded to, we're going to try to continually improve the process of the review process. And finally, if you had any specific feedback about this conference call, I would love to hear that as well. So any or all of that, please let me know.
Thank you so much for doing this, you guys. This is, having done this for a number of years, I was delighted to have this opportunity.
Thank you, Martha.
And thank you to
Any
everyone
final
for
comments?
participating.